Talking HealthTech was front and centre at the Digital Health Festival in Melbourne, Australia a few weeks ago. During the event, we got to speak to a number of bright-minded individuals who featured on the big stage, and you can go back a few episodes in this feed for more of those conversations. During the event as well, I got to spend some time over at the exhibition booth of Fluffy Spider Technologies, who are proud THT Plus members and are on a mission to unlock growth opportunities in digital health through partnerships and integrations. In this episode, I speak with the CEO of Fluffy Spider, Robi Karp, and we talk about how to make legacy healthcare systems and modern solutions more interoperable, why partnerships are crucial for growth within the healthcare ecosystem, and the importance of working with frontline clinicians to design user-friendly solutions. Here we go. Collaboration starts with a conversation, Team HealthTech. Let's make it happen. This is Talking HealthTech with me, Peter Birch, featuring content and community about technology in healthcare. G'day, Robbie. How you going?
I'm very well, thanks, Peter. How are you?
Good. It's great to be able to have a chat and be in person here in the makeshift Fluffy Spider studio. So
Yes.
Thanks for bringing me along. I've seen there's a lot of activity over at the booth here at Digital Health Festival. It seems like you've been busy since the last time we spoke.
We have. We've got some new partnerships I might be able to tell you about. We're now InterSystems implementation partners. That's pretty cool. I'm really into the technology. I'm a software guy myself. You know, if I was going to create something, it would be something like that. It really appeals to me. It's a very nice piece.
There's a few things we'll dive into, and I know we've got to finish up soon because you're going to be jumping on the stage live to tell everyone about it. But let's unpack a little bit more. For people can go back and learn a bit more about Fluffy Spider, because we spoke a while ago on the podcast, but just refresh the memory. What space do you operate in?
So primarily we offer three services. We offer integration services. So we have senior specialists who are HL7 qualified, certified, FIRE certified, soon to be InterSystems certified. We have AWS solution architects. These guys are all in-house, and so we will do things like integrate new workflows into EMRs, integrate cloud systems to EMRs, medical devices, that sort of thing. So that's what we call integration services. The other thing we do is we call software development. It's more mobile apps connected to the cloud. There's always a cloud backend to a mobile app. So when you say mobile app, you always imply something behind it. We're doing some really cool stuff around that. And the third thing we do is what we call advisory and consulting, where we will, help put together and clarify requirements and that sort of thing. And
I can imagine why then you'd have a lot of interest at a digital health festival and generally within a healthcare space right now, because some of those problems that you're solving are the problems that many frontline clinicians and vendors are facing on a day-to-day, right?
They are. They absolutely are.
Where is the biggest element of work? Is it in that integration space? And
so what we're finding, we almost think of it like two very distinct lines of business almost. So integration, we're working through the partnerships mostly. So besides the InterSystems one, we have another partnership with Fujitsu Health. We would work through them to do different state department, healthcare integration services. That's very different to what we call the software development, because in that case, it's more about placement of people. So we do have, as I said, these specialist engineers, and Fujitsu might say that we need someone for a short time to work in this particular technology. Do you have someone? Yes, we have someone. InterSystems, similar. The mobile app is what more we call the software development, and that tends to be more project driven. Okay, that's not to say we can't do either or. Sometimes, yes, integration, it's like, hey, can you give us a quote for this? Fine. Or, hey, we need a mobile developer for 3 months. That's fine too. But yeah, so coming back to answer your actual question, mostly through the partners.
And the InterSystems thing, I mean, we've InterSystems no strangers to Talking HealthTech as well. That's a really exciting opportunity.
Yeah, it actually really is. We first connected with InterSystems exactly at Digital Health Festival last year. It's taken quite a bit of a journey because, there's from my point of view, we're not a massive software companies. So to invest into a specific technology, there's an investment needed, and you need to think about where that's going to take you as a business. But as I said, look, the technology itself is terrific, and I'm sure you're aware that they're very prevalent in the healthcare space. Specifically, I don't know if you know that the Epic medical record system is all built on top of InterSystems.
I didn't actually know that. I didn't know that. So,
no, it is. Yeah. Besides that, they've got their own, EMR and other things. So I'm not speaking InterSystems specifically now, other than to say, again, as a software engineer, I've looked at their code, I've looked at all of the systems. It's really lovely to work with. So it's appealing from that point of view. But look, in this kind of an environment, and the way that we're moving towards standardised systems, so first of all, I think, and I'm going to be speaking about this later, the standardised systems is important. We need open standardised systems so everyone knows the language that we're speaking to connect. But at the same time, I think it's very important that we have corporations standing behind the open standards, supporting them, because otherwise they're going to actually just fade away and no one will use them. Okay, and for us, as I was starting to say this, as a smaller vendor, the partnerships are critical. Okay, when we could invent the new health interconnection software, and we actually had a go at it. We did a proof of concept internally, but to take that to market is a very different kind of a thing than doing an internal concept. So the challenge is all about market awareness, market traction, and then working against the larger companies. So for us, it's all about partnerships.
I imagine too then for an organization, and there's many large organizations and startups, those that are creating solutions, to be able to partner with the experts, people who get in one particular area and become really proficient at it, because that's what other professionals do in other industries as well. So working with those that know this space
exactly
really well. Yeah.
You need specialists. You really need. This is not general purpose software anymore. Okay, and it's only becoming more and more complex, because really what you're going to be doing is taking these a system that's built on top of open standards, and you're going to use that to build even more complex solutions. That's what you want to do. You want to get to these really beautiful connected systems. They all talk, they're all interoperable, and you need to have specialists who understand the way to connect it all up and the way to implement it.
How do you describe Fluffy Spider to the frontline nurses and the doctors that
the name or the work?
Oh no! Because for those that want the explanation for the name, they have to listen back to the old episode, because he gave a good explanation of that
episode 298.
Oh, there you go. That's I appreciate that you remembered the number too.
I've been telling people that all day.
Yes, I love that the logo, our Talking HealthTech logo,
of
is
course.
there.
Look, I'm very serious about partnerships. We're not going to do it on our own. Talking HealthTech is a critical partner of ours, as much as anyone else. We need to build that ecosystem where we know that we have friendly partners. Some of them will overlap in what they do. Good to have a bit of competition in there too, but it needs to be a very collaborative all around. And look, frankly, Talking HealthTech for us, nobody else does what you do.
Oh, thank you. Well. There you go. We could finish there, but we're not going to, because that was it. But back to the point of the nurses, the frontline healthcare workers that are using the thing on the day-to-day, because they'll probably engage with the technology at a few layers down.
Yes.
Yeah.
First of all, they're not really our target market, but what's important is, it's always good to be speaking to the people who are really using the technology itself, because what you get from that, so I'm a software guy, I'm not a clinician. And I'm learning. It's been some years in the healthcare industry, but I won't even pretend I've worked in it from a frontline. But what you get is a knowledge of how the systems work, how they need to work, what the workflows are. And so now coming back to when we're designing dashboards and when we're designing mobile apps, what's important? And when we're putting together requirements, if it was just up to me, we would make it all very technical, and it would do what it needed to do to the letter. But will it be really useful? Maybe not. It's really good from that perspective. And what's actually really, really important to know is that they're trying to get through their day. So they're trying to, very, very efficiently, get through to the next patient so that they can make sure they cover the patients. What they don't really want to do is interrupt the workflow with, even if it's a new, thing, unless it's going to save them this massive amount of time, they're just like, no.
Super important. And then, because we've mentioned that you'll be addressing quite a few people on the stage, and that'll be really good. Is this the types of topics that you'll be talking about? What are you going to be talking about?
Today, I'll be talking about enabling interoperability in legacy healthcare systems. I'm going to actually go through a specific journey of my GP, talk about how I may be able to make his system interoperable. My GP is about 85 years old, okay? And, he's not changing his system anytime soon. I go through like a, very real situation of something that happened with me, work through how that might be overcome.
Like from a patient experience point of view and the technology. Well, this is a really interesting point, highlighting a few elements that I speak about regularly, whether it's on the pod or just generally around. To that point, the clinician who's not in market at the moment for changing, like transforming how they do their practice to then make it more innovative for the next 15 years, they're looking at just getting the job done on day to day to care for a patient. At the same time, from a patient's perspective, if there's an opportunity for it to be better by improving the technology, then you've got that interesting kind of tension there of like, well, there is this great opportunity for technology to improve patient care.
One of the examples I'm going to be giving today, so I did a whole bunch of research and interviews for the presentation. So I spoke to a lot of clinics and IT managers for hospitals and that kind of thing, specifically for the making legacy systems interoperable theme. And like some of the stories are, they're crazy. So there's one example I'm going to talk about today where exactly what you said, there was a clinic, they wanted to make the onboarding experience for the patients nicer, more seamless. So they would come in, fill out a paper form normally. So they thought, okay, we'll build web forms. They can fill it out before they come in and submit it. So they've got that, they did that, they had an in-house team. It was like not terribly difficult, but the system that they're using at the back end, no APIs, no nothing. You can't integrate it. So what they do, and this is the thing, they employ a team to copy-paste the web form info into the, patient management system. Like, just think about like the overhead there. Like, so the patient experience is good, but the integration, I mean, oh my goodness.
Yeah, it's messy, not scalable, and prone for errors. Like lots of reasons that can fall down. So that's a great example. I'll definitely be catching that session. And then lastly, after Digital Health Festival, you've got partnerships, you've got lots of work to do, and no doubt some opportunities coming off the back of today. But what's going to be your priorities? What can we look forward to seeing from Fluffy Spider over the next 6, 12, 24?
We see the two lines of business we're working on to be only growing. I mean, there were announcements coming out often about health information exchanges and interoperability projects, and through our partnerships we're looking to grow those lines of work, specifically the integration one. We see that as a very big opportunity for us. We're growing the specialists there so that we can place them, so that we can get the projects. And look, really we see that as a really big opportunity. Look, these are very, very long-term projects. I mean, a hospital may announce that it will put out a request for tender, and it'll be easily a 6 to 9 month window before the tender response closes. And then the project itself will run for 12 months. So this time next year, maybe we've closed a few of those, but we see that as a huge opportunity for us because really we're a landlocked country here. We have people internally who are specialists, and in those cases where you need people on the ground internally, we provide that service.
Robbie, it's great to chat on the podcast and look forward to doing it again soon. Good luck on the stage, and we'll chat more in the community. Thanks so much.
Thanks very much, Peter. Good luck for you on stage as well.
For more content and community about technology and healthcare, visit talkinghealthtech.com.